So over the last 20 years or so, the percentage of Vermonters who are obese has almost tripled. Is it time to take a serious look at something like taxing sugar-sweetened beverages? What's the strategy to deal with what appears to be a growing epidemic of obesity?
Oh, I would certainly agree with you that there is an epidemic of obesity, and that's the #2 modifiable risk factor for death. And there's tremendous costs associated with it from our healthcare system. I think trying to make changes throughout our culture, whether it be in schools, in employers, in the houses, in our medical practice, are all important for us. And certainly sugar-sweetened beverages, as far as I'm concerned, the new school lunch law will help that, because there'll be rules associated with that in terms of better, healthier foods in schools, less competitive foods. I certainly would like to see sugar-sweetened beverages taken out of the schools. In terms of a tax, well, that's certainly a policy question that we'd have to decide. But I certainly think that the less sugar-sweetened beverages people drink, the better. I think the policy issues are another question entirely.
People who
I just want to add to that, just to make sure that we answer the question accurately. It's worth mentioning that this study measures how we're doing compared to the other states. All of America faces an obesity challenge. It's not just Vermont's challenge, as we all know. And Vermont, what this study says is, Vermont is doing better than any other state in the country on all of the issues of approaching public health to get healthy outcomes. We all face the challenge of obesity together in all 50 states.
So is it a question where we're getting fatter, but they're getting fatter faster? Or?
I think it's a question that that for the first time in American history, it's projected that Americans will live less long than their parents because of obesity. And that has to do with how much we exercise and what we eat. And it's a challenge for us as a nation that we got to face together. I just want to make clear, Vermont right now is doing better than the other states in terms of healthy outcomes. That's what this report states. We should be proud of that.
Well, if you look at the cigarette tax and raising the tax, people feel, health advocates felt that the more you raise the tax, it was likely that you could discourage youthful smoking and maybe smoking in general. Why wouldn't that same principle apply to sugar-sweetened beverages?
You know, my feeling about taxing to get outcomes in this area are pretty clear. I believe that the best way that you can deal with questions of obesity is through education and ensuring that we get to both kids and parents to give them the information that they need to make healthy choices. We can make great progress there, and that's where I'd start. One of the challenges with taxing sugar as a method of reducing consumption, in my view, is that it's a very regressive tax, and it tends to ask those who can least afford it to pay the most. So I would suggest that we start with education.
Governor, the Vermont Low-Income Advocacy Council, however, supports a sugar-sweetened beverage tax.
Sure, I'm sure there are a bunch of folks who do. I just don't join them. I think that we should all concentrate our efforts on designing a healthcare system that rewards healthy outcomes. And from our schools to our early childhood providers to every institution in the state, we should all be working together to do better on preventative care. And that involves educating Vermonters to obviously eat more locally grown Vermont healthy foods and stay away from foods that are unhealthy. But that's how I approach it.
So what I would say is, just to emphasize what you said, you're right. The whole nation is getting fatter. We're getting fatter at a slower rate. We're not the #1 state in terms of the lowest obesity rate, but we're in the top 10. What I would say is that a sugar-sweetened beverage tax clearly is not, it's not a magic bullet, that we're going to have to attack this in a broad-based cultural perspective, whether it be a healthy farm-to-plate, farm-to-school network, whether it be getting people up, getting them more active, as this study showed, getting people to be healthier in their workplace, turning off the TV, taking that walk. Those are all things that really have to happen. It's just that there's no magic bullet here.
But you've got something that's tripled in 20 years. You describe it as an epidemic. Governor, you say what we need is education. Isn't it pretty clear over the last 2 decades that whatever people have been trying to do has been a total failure?
I don't think that we were doing then what we're doing now, and that's the difference. You know, when I was in school in Vermont, we had soda machines in the schools, and there was no awareness that there was any link between obesity and how many Cokes or how many 7-Ups we drank. There just wasn't. When we went down with our allowance to the grocery store, we all bought, you know, pretty sugar-filled candy. All I'm saying is that the awareness curve on this issue has moved leap years, and if we can move to a healthcare system where we reward our providers for outcomes instead of number of services, and we insist that through education in our schools and communities that we educate Vermonters about what's healthy and what's not, I would argue that we failed pretty miserably in certainly my generation of Vermonters on all of those fronts, and we're making great progress now.
You talk about local and healthy foods. A lot of our local food brands are, I mean, I think of Ben & Jerry's, Lake Champlain chocolates, all the great beers. They're not particularly good for you, right? I mean, should there be more of an emphasis with our food makers, manufacturers, to get them to promote, you know, I don't know, their Brussels sprouts or something, or?
Sure, you know, I think you should go up there to Waterbury and start a Brussels sprout ice cream.
So actually, could I answer that and to say that we really have a very robust farm to plate network in Vermont, and a lot of that relates to the farmers markets and that whole network. And so I think that's a Vermont brand. It may not have the international and the national recognition that Ben & Jerry's and Lake Champlain has, but I think it's equally as important.